Now we're going to turn to the third in our series. It is not your mother's plastic surgery. This morning, we're going to talk about a type of breast surgery without any scars. About 90,000 women a year have breast reduction surgery, which is extremely painful and often means those disfiguring scars. And tens of thousands more would have the procedures if it wasn't so difficult to endure. Our Dr. Nancy Snyderman gave us a look at a remarkable new procedure that is quick, pain-free, scarless, and soon to be state-of-the-art for thousands of more women.
It's no secret that in America, a full, extra-large bosom has been considered the feminine ideal. But not for some women. For them, bigger is not better.
No, this will not do.
Meet Lynn Bickert-Coyle. At 49 years of age, she's a 38 double D, and she says it has almost ruined her life.
It's easy to make light of big-breasted women, and it seems to be every man's secret desire to have a woman with breasts that are quite abundant. But in fact,
It's not fun. No, it's back pain. It's depressions in your shoulder that are about ½ an inch deep from wearing a bra strap that has to be wide to be able to support the weight of the breast.
The size of her chest has been an unhappy issue for Lynn since the 5th grade.
I think I was probably the first one in school that wore a bra. I mean, it was like a joke. People would talk to my chest instead of my eyes. And it just gets a little discouraging after a while. This will never work. You have to go the other way.
Try it. Think, right now, of Lynn's everyday life as a 38 double D. Buying clothes is almost impossible. When Lynn plays golf, she can't get the tapered clubs designed for women. Her arms won't fit around her chest to grip them.
I have to keep my arms around me instead of being able to keep my arms this way, because otherwise I can't get close enough to the ball.
The back pain is unrelenting, just from carrying around the extra weight in the front. Lynn's pain is so severe that she sees a physical therapist 3 times a week.
Leg comes straight out, don't let it touch the mat. Good.
For 8 years, Lynn has considered having her breasts reduced. But the traditional surgery scared her off. It's invasive and painful. Lynn opted out. Until she met Dr. Sherwood Baxt, a plastic surgeon who uses a brand new, minimally invasive liposuction technique for breast reduction.
The Scarless Reduction is basically a very special variation of liposuction. And what we do is we're able to reduce the breast by anywhere from 1 to 3 cup sizes.
There is no radical cutting and only a pinpoint scar. Lynn is the perfect patient for this approach. But according to Dr. Michelle Copeland, a plastic surgeon in New York City who also does this procedure, it is not for every woman.
A woman needs to have a breast that doesn't have too much sagging, but that has volume.
Here's how it works. A tiny incision is made under the fold of Lynn's breast, just large enough to insert a tiny cannula or tube. In a woman over 30, breast tissue is made up of a significant amount of fat. The excess fat is sucked out. The surrounding skin and nipple adapt to the breast's new shape, like taking some stuffing out of a pillow. That's it.
if you've gone through half your life with these breasts, I mean, why now?
It doesn't mean they're my best friends. They've always been in the way.
After a quick goodbye to her husband, Richard, Lynn walks right into the operating room. In a few minutes, she'll be sedated, but not under general anesthesia. And Dr. Baxt goes to work while I observe. First, the doctor pumps in a saline solution, which helps to separate fat from the other breast tissue. Then Dr. Baxt begins the liposuction.
But it sure beats the old surgery, the big incisions.
Altogether, Dr. Baxt removed just about 2 liters from Lynn's breasts. That translates into roughly 3.5 pounds and 2 cup sizes. 2 hours after surgery, Lynn is ready to go home.
Well, when they unwrapped me to change the dressing, I went, wow, I'm smaller.
We visited her just a few days later when her post-op swelling had subsided.
It's flat, and it even kind of goes in a little. I love it.
Remember, this is what she looked like before. And here she is now.
My overall reaction has been absolute pleasure.
For the first time in her life, Lynn feels like her body is in proportion. For her, ordinary feels like a miracle she's waited for more than 30 years.
I have never felt better. I don't think I've ever looked better. My back doesn't hurt. I feel better about myself.
Yes, this definitely.
Ah, well, our thanks to our medical correspondent, Dr. Nancy Snyderman, for that report.